40% of 55 to 74-year-olds have age-related hearing loss, according to the International Journal of Audiology. The jokes can be funny. 3 men are walking and one says, "Windy, isn't it?" Second replies, "No, it's Thursday." Third responds, "So am I, let's get a beer." But hearing loss is no laughing matter, and there's more to it than just not being able to hear. Keep watching. Hi, I'm Kyle Kuhlman, a board-certified licensed hearing instrument specialist with Eye Surgeons Associates. So what happens if you neglect treating hearing loss? You can't hear, and you lose ability to process words and sentences. It works like this. The brain interprets sounds or signals that make up speech. When a person has hearing loss, some signals are not relayed to the brain. Our brain is like any other muscle in our body. It needs a workout. Without it, it tends to deteriorate. That old saying, if you don't use it, you may lose it, it applies to your hearing. Hearing loss is typically gradual, and while hearing diminishes, so does the ability to process speech. This is why hearing loss is about more than just not being able to hear. Research on aging has also linked hearing loss with an increased risk of developing dementia and losing cognitive skills faster. The findings add to a growing list of health consequences associated with hearing loss, including increased risk of falls, hospitalizations, and diminished physical and mental health overall. Hearing loss can lead to social isolation, depression, and anxiety. It can affect work as well as put you at risk of losing income. Addressing hearing loss can improve your quality of life, health, and activity level. You should have your hearing checked if you have to strain to hear a normal conversation, watch faces to follow what's being said, frequently ask people to repeat what they've said, have difficulty understanding women's or young children's voices, hear ringing or other noises in your ear, turn up TV or radio excessively to hear, or have trouble identifying where sounds are coming from. If you answered yes to any of these, it's time for a hearing exam. Don't miss out on conversations with your loved ones, or put yourself at risk for decreasing health. You wear glasses to see, so think about a hearing aid so you can hear. Eye surgeons can help you with both. Watch my next video about what to expect during your hearing exam, and I'll tell you about hearing aid options that'll get you back into the conversation. Thank you for watching.